I can see a few nods from the panelists. Fantastic. Thank you for joining our webinar launching Australia's 2025 Climate and Health Priorities. I'm Caitlin, the Climate Change Officer at the Australian Nursing and Midwifery Federal Office. I'd like to formally introduce Annie Butler, the Federal Secretary for the Australian Nursing and Midwifery Federation, to deliver our official welcome to our event, held today in partnership with the Lancet Countdown. Annie's a registered nurse with a decade's experience working in public hospitals, the community, and on health education projects, and a further decade working in research and education. She worked for the New South Wales Nurses and Midwives Association for a further decade as a professional officer, organiser and lead organiser prior to moving to the national position of Assistant Federal Secretary and now holding the position of Federal Secretary. Thank you, Annie.
Thanks very much, Caitlin, and good afternoon, everybody. And thank you so much for coming to our webinar this afternoon. As Caitlin just said, I'm the Federal Secretary for the Australian Nursing and Midwifery Federation, and it's great to have you all here. I'd just like to start by acknowledging the traditional custodians of all the lands we're joining this meeting from. I'm joining from the lands of the Wurundjeri people of the Greater Kulin Nation, and I'd like to pay my respects to elders past and present and to any First Nations people joining us on this meeting today, and extend those respects to all the custodians of all the lands that you're joining from. It always was, always will be Aboriginal land. So as I said, thank you so much again for joining us as we launch our health and climate change policy document that we've developed in partnership between the ANMF and the Lancet Countdown. And we're going to be welcoming you're going to be hearing from, but I'd like to first welcome our guest speakers, Professor Paul Beggs, Associate Professor Ivan Hannigan, Michelle Isles and Liam O'Brien. Our speakers will help expand our shared understanding of the evidence, challenges and opportunities that underpin the advocacy work that the ANMF is currently doing. So, as the largest union in the country, representing more than 345,000 nurses, midwives and care workers across the country, the ANMF cares deeply about providing a response to the critical threat of climate change. We know that climate change is one of the greatest threats to human health of our time. And shortly, we'll hear from Professor Paul Beggs, Director of the Lancet Countdown Oceania region, who'll speak to the work of the Lancet Countdown in tracking the evidence on the health impacts of climate change. And as I mentioned earlier, we're proud to launch today our new policy document developed in partnership with Lancet Countdown, setting out our shared priorities for action on this issue. So we have three key priorities: a framework for clean air. When we talk about climate change, we can't ignore air pollution. The same emissions warming our planet are the ones harming our lungs, hearts, and overall health. We're joined by Associate Professor Ivan Hannigan from Curtin University's School of Population Health and the Centre for Safe Air to help unpack these links and what they mean for health. The National Climate and Health Strategy, through health workers, including nurses, midwives and carers, nurses, midwives and carers are already championing responses to climate change, our health sector can't rely, as we well know, on goodwill alone. It needs real investment to turn ambition into action, which is why Michelle Isles, CEO of Climate and Health Alliance, will be speaking to the National Health and Climate Strategy and why funding it is vital for protecting health. Finally, the issue of fossil fuel subsidies. As we look to the road ahead, it's imperative that the Australian government releases funds from inefficient fossil fuel subsidies and reinvest these funds back into communities responding to climate change. To speak about these economic levers and the role of a just transition, we're joined by Liam O'Brien, Assistant Secretary of the Australian Council of Trade Unions. The ANMF is committed to action on climate change and reflects this commitment to climate action in our 6 federal strategic priorities. And today, as you just saw at the very beginning of this webinar, we're joined by the ANMF Federal Climate Change Officer, Caitlin Richards. As a registered nurse, Caitlin holds a dedicated portfolio focused solely on climate change, ensuring that our ANMF advocacy, policy and support reflects the needs and priorities of our members. Once again, can I just say thank you so much for joining us and this webinar launching our policy document, and I'll now hand back to Caitlin to chair the rest of the webinar. Thanks again.
Thank you so much, Annie, and it's such a delight to have you welcome us formally. Hello to everybody who has joined us today. On the webinar, we have many different people joining us in. We have panelists to NGOs, union members, organisation leaders, officials from AHPRA, researchers, academics, and of course, health professionals, nurses, midwives, carers, doctors, and medical and allied health professionals. As Annie mentioned, we're excited to be launching our document, but we have, to speak to the evidence behind some of the policy asks, exceptional lineup of expert speakers. Before we do get started, some housekeeping and information you need to know to get the most out of our hour today. Please familiarise yourself with the Q&A controls on your screen. This is how you can submit questions to the panellists today. We will be doing some moderating though to avoid repetition in the questions. If there's a question you see that somebody submitted that you like the look of, you can upvote that by clicking the like button. Please note, we are recording today's webinar. Your camera and microphone are automatically switched off, but if you enter a question in the Q&A, it will be recorded. And finally, a friendly reminder to the speakers, we have a jam-packed agenda today with lots of powerful presentations, so please do try and keep within your allocated time frame. Our opening address, we're very privileged to have Professor Paul Beggs to deliver. Paul Beggs is the professor in the School of Natural Sciences at Macquarie University, but he's also the director of the Lancet Countdown Oceania Regional Centre, which tracks progress on health and climate changes in this region and produces the annual MGA Lancet Countdown report. Paul is also an author of the annual Global Lancet Countdown report, which he will speak to in his address. Thank you, Paul.
Thank you, Caitlin. Can you see my slides now?
Yes.
You can. Fantastic. Okay, so good afternoon, everyone. It's a pleasure to be here. Thank you so much for the opportunity to talk to you today about the Lancet Countdown on Health and Climate Change and also its 2025 report. The Lancet Countdown is a large international collaboration of leading experts on health and climate change. The three core functions of the Lancet Countdown, as you see here, are research and monitoring, communications and outreach, and policy engagement. The Lancet Countdown has been publishing in the Lancet annually since 2016, and just yesterday published its most recent report, the 2025 report, looking at health and climate change. So this most recent report is the 9th annual indicator report of the Lancet Countdown, and we report annually, as I said, just ahead of COP each year. So COP is the United Nations Climate Change Conference, and this year it's happening in Belém, Brazil, from 10 to 21 November. So we publish just ahead of COP with the aim of providing an evidence base on climate change, and accelerated action and the need for that, and also putting health at the centre of climate change. So you can access the full report at the links that you see at the bottom of this slide. So at the Lancet website itself, and also directly at the DOI link that you see down the bottom there. This year's report has 128 authors from 71 contributing organisations around the world. This includes leading university and research organisations and also key United Nations organisations such as the World Health Organization and the World Meteorological Organization. This year's report has 57 indicators on health and climate change, and they're spread across 5 broad domains of the Lancet Countdown. And you see those 5 domains illustrated here. So central to what we do is looking at the health impacts of climate change, but we also importantly look at the responses to those impacts in order to try and avoid or reduce them. So that's health adaptation and the health benefits of mitigation. We also look more broadly at the issue of health and climate change by looking at the economic impact and context, and also public and political engagement and context. I wanted to spend my remaining couple of minutes by looking at the really high-level outcomes from this year's report. So the first, as you see here, is that delays in climate change action are increasingly costing lives and livelihoods. Millions of people die needlessly each year due to fossil fuel dependence, growing greenhouse gas emissions, and failure to adequately adapt to climate change. This slide shows a figure from the report. So this is many of our health risk and impact indicators, which you can see listed down the left. So we track these annually, as I said, from 1990 through to the year 2024, the most recent year that we have data for. And we've color-coded the results for each indicator for each year, with the dark blue indicating the most favourable results and the bright red indicating the least favourable results. You can see that we're heading in the wrong direction for many of these indicators, so things are getting worse as time goes on. And indeed, for the most recent year, 2024, you can see that the result for many of these indicators was the worst that we've ever had over this 35-year period. Another major outcome from this year's report is that backsliding on climate change action is putting people in harm's way. With adaptation becoming increasingly costly and challenging, reversal of climate change commitments threatens to worsen health harms and economic strains. But there is a silver lining in this year's report, and that is that climate change action offers a lifeline. The life-saving impact of the limited action delivered so far is already being felt, and global momentum is building for further action. So countries leading the transition are already enjoying health and economic gains. Meanwhile, local and grassroots leadership is building momentum for a healthier future from the bottom up. So I wanted to really highlight the three things that come out of this year's report. So in conclusion, the data reveal the life-saving potential of climate change action. Backtracking of climate commitments from key leaders and organisations is putting livelihoods, health and survival at risk. So protecting people's lives and health now requires all hands on deck. So I'm delighted to be talking today with the nurses and midwives around Australia who are key and central to solving this problem. Thank you very much.
Thank you, Professor Paul Beggs, for your welcome address and for taking the time to explain the importance of this work. And as Paul mentioned, you can access the report via lancetcountdown.org, and it should be front and centre for reading the report and the findings from this year's evidence. Much of what Paul shared can be a little bit confronting, but much of the evidence that we have access to today highlights that we can translate feelings of overwhelm into more positive and hope by taking action, which is why it's so great to convert some of these things that we're learning about into key steps that we can take. So we now have the privilege of hearing a bit more about the context behind some of the policy asks with the ANMF and Lancet Countdown have put forward in Australia's policy priorities, and hearing from our panellists who are experts on this matter. Speaking on air pollution, I have the privilege of introducing Associate Professor Ivan Hannigan. As Director of the Curtin World Health Organization Collaborating Centre for Climate Change and Health Impact Assessment, Associate Professor at Curtin University, Ivan Hannigan is a professor in the population health. He collaborates on diverse Australian and international projects, and we're delighted to be hearing from him today. Welcome, Ivan.
Thank you so much, Caitlin. I'm going to reiterate some of the points. Well, the key point that I want to make sure that comes across loud and clear is the urge to think local and act global. And you can see that in my role, I link what goes on in Australia with our broader region through the World Health Organization and a global ambition for my university to really be a global university and call for cleaner air and explain its health benefits really broadly so that we can do these local actions that are here and now and have impact globally and for the future. As you probably realise, Australia is really interesting internationally in air quality. We are experienced across the spectrum with some examples of very, very clean, good air and other examples of very poor and unhealthy air. And so that's a really important thing about Australia. Other places in the world, sometimes they get studied by health scientists because they always have unhealthy, bad air. But Australia presents us with really observations across the spectrum where we do have problems and we can use our science to quantify these things. And we also have examples of where it's good. But it is really important that we acknowledge that air quality is a problem in Australia. Often it is in some neighbourhoods, what we call hotspots. Sometimes it's connected to certain periods like the bushfire seasons or dust storms during droughts. And in other things, it's about certain buildings and the way that we have built our, what I call habitat, the cities and the places where we live. And so a lot of the research that I've been involved with in Australia has focused in on these types of air pollution problem, focusing mostly on the ambient air, the outside air. This has been a recognition of the big issues with particulate matter, fine particles, we call PM 2.5, and also traffic-related air pollution that hangs around those industrial and transport routes, NO2. And I've got examples of these on the pictures on the side. But we need to think even more locally as well and recognise that there's an indoor-outdoor transfer of air. And so our indoor air is of concern as well. And there's indoor sources of air pollution that are very concerning, but we have limited data to study. So what the general activities have been focused on has been linking up all of these sources of air pollution, the patterns and the processes of air pollution, and being driven by this understanding that the local area and the things that we do, and in this graphic, we're actually focused on the health sector because this is from the World Health Organization. As I said, we really focus on what is the health professional community able to do, understand, and impact on. And there are air pollution and climate impacts from the health sector. That's shown by the smokestack, presumably from health systems and facilities emitting pollution in their local neighbourhoods and contributing to global warming, which then has a feedback health effect on our communities. And those are the kinds of pathways where climate change can then lead to these global change problems. But we have this idea in climate change research about co-benefits. We can talk about the benefits of cleaning up our air for people now in our local situation, in our patch. And the co-benefit is that we will also at the same time have a win-win where we can solve problems globally and for the future. So focusing in on the kinds of pollution in Sydney, which is a bit of a microcosm of Australia's situation, we do have a large number of natural sources. They, like I said, droughts and some of the fires, not all of the fires, but you can see that the human-made sources have been disentangled here. And we focus in on energy and heating, wood heaters, power stations to keep the lights on, and our transport. Now, on the right-hand side, this is a tracking year on year, the profile of our energy supply, which is the demand for energy from these sectors then leads to us needing to supply that energy, often through dirty energy supply, and we burn stuff to supply that energy. And the energy demands are for our transport and our electricity supply, and you can see such a large component. Now, I want to shift gear into the health science, and really I'm on a mission to open up the discussion for long-term chronic exposure to unhealthy environments, in this case, air pollution that accumulates over this worker's life over decades, and they have a reduced health in later life. And that contrasts to what a lot of the general population consider to be the worst effects of air pollution, and probably a short-term acute exposure from a toxin, which operates in minutes, hours, or days. But really, as a population scientist, one of the crucial insights is that over our life course, we have these chronic exposures to our environments from birth, childhood, growing up, and our careers in our work. And a more exposed population, here shown as the dotted line, has a higher vulnerability at all ages to health shocks. Now, this can be seen over time as connecting up with these short-term stressors. A pollution spike, a bushfire, a smoke event may exacerbate issues that you've got because you've been exposed to unhealthy environments for your whole life. And in fact, a population who's been exposed to air pollution in their homes, in their work, in their natural environment for decades may actually be more vulnerable to shocks like a virus or some other stress on their biological system. It doesn't have to be an air pollution event that actually culminates in an air pollution attributable health outcome. And so this cartoon that I've got here really is aimed to broaden out that discussion and make us think across the life course and different types of people in different environments and protecting them so that they age healthily. And that call for cleaner air in Australia will hopefully lead to improved health outcomes across a range of not only non-communicable diseases, but also infectious diseases. It will improve productivity because we'll be healthier and we will have healthier children, learning better and enabling healthier aging, and ultimately reduce greenhouse gas emissions to secure long-term protection. Thank you.
Thank you, Ivan. I remember learning about the World Health Organization guidelines for cleaner air, and it was once I started pulling on that thread, it was truly a deep rabbit warren. And I'm sure that there will be lots of questions about your expertise in this area. I'm very lucky to have you speaking to air pollution today. Next up, we have the delight of hearing from Michelle Isles speaking on the National Health and Climate Strategy. Michelle is the CEO of the Climate and Health Alliance, having served on the Federal Minister's Advisory Council on Climate and Health, and as a director of the Global Climate and Health Alliance and Healthcare Without Harm. Michelle has influenced national policy on energy, housing, and pollution. She's led innovation and strategy to address climate risk and resilience. Welcome, Michelle.
Thank you so much, Caitlin. And great to be with you all here. I should also note that I am a daughter, a sister, and a niece of nurses, and so nursing is been embedded in my whole life, and I've worked alongside nurses and midwives in some of the most challenging circumstances during COVID and with some of the shocks and stresses of climate change, fires and floods. And I, of course, saw the strain, but also the response, the collaboration, the way that this workforce and you all work together. But we want to make sure that you are safeguarded and that you have the skills and support to be able to respond to these challenges. So let me take you through a bit of history about the National Health and Climate Strategy and where we're at now and why this call to fund the strategy is needed. Thank you. I'd like to acknowledge that I'm today on the Yugambeh country on the Gold Coast. And this young Yugambeh woman is showing the nets, a craft that has fed and nourished the Yugambeh people for tens of thousands of years, an art and a practice that's been passed on for that time. And for me, it really represents the weaving together of history and present, the importance of thinking about First Nations people, self-determination and health equity, and that opportunity that we have to weave together climate and health outcomes. They're not separate, they're absolutely intrinsically connected. Thank you. We've already heard that climate change is the greatest threat to health we face, and that the driving, escalating harms to public health and straining healthcare systems is a challenge that we face. So at CAHA, we're building the power of the health movement for climate action, community resilience, and sustainable healthcare. And by way of background, having just been in Queensland, this week we had 38 degrees on Monday, and then we had torrential rain. And these images don't reflect that event, but do reflect Queensland's experiences in the last few years. And we know that these events have an immediate impact on nurses, on midwives who are caring for community in various settings. And we need to be able to prepare because these events are happening more often. The next slide shows that CAHA is an alliance of 100 organisations, 47 different professions, but I will say that nurses signed up first and have been fundamental to building understanding in communities and in policy settings around climate change. I live in regional Victoria. Nurses have not only been my colleagues, but they are community members. They make up most of our regional communities, as do midwives. And so the voices of nurses in our alliance is really powerful. And our founder, of course, was a nurse and saw the strength of alliance. And I'll continue through the slides. Thank you. And just to say that we work both on trying to prevent people going into hospital through public health issues, and this is what the National Health Strategy, Health and Climate Strategy articulates, but also work with health workers and leaders to respond to the climate impacts and also to decarbonise and to reduce the use of materials that we don't need that are harming our environment. Next slide, please. So the journey towards the National Health and Climate Strategy was long, way before my time, and with nurses with both the pen and using their voices to advocate for change. At CAHA, with the ANMF, we developed several different versions of what a framework could look like and ensured that both community leaders, health leaders, and politicians and decision makers were across these initiatives, were inputting and shaping. And I would also say that First Nations organisations, 15 of which are members of CAHA, have absolutely also underpinned this work, and we advocate, support and amplify the aspirations of First Nations organisations, and particularly in shaping this strategy. Next, please. These other key documents, which were also shaped by nurses, were about looking at where we need to be. So what's the purpose of having a National Health and Climate Strategy? It's for the specific actions, but it's also about envisaging healthier communities. That's why we show up for work. That's why we do this work in care. Next slide, please. And so in 2023, the National Health and Climate Strategy was launched. It was a groundbreaking moment in Australian policy settings. We're in an enviable position internationally to have now this focus. So to have the federal government overseeing and understanding the implications of climate change on health, and having that national focus on the training and the resources that are needed across the states and regions to be able to deliver on this. Next slide, please. However, we have been monitoring the progress of the strategy. It's something that our alliance members, nurses, work so hard to advocate for. We've been tracking progress. And one major hurdle remains, and that is significant funding. So we have a national unit that has really been working towards and delivering on lots of actions as part of the strategy, but they've come to a point where there's not much more they can do without a dedicated budget, and that's what we need. This strategy covers a gamut of actions, from which I'll probably get to the next, go to the next slide just to articulate. So from adaptation, responding to the climate challenge. Just a moment ago, I spoke about the impacts that were experienced just here on the Gold Coast a couple of days ago. These events are happening more often, and we need adaptation and resilient measures that consider the impacts on health workforces, that build resilience not only in infrastructure, but also in communities that we care for. And so advocating for critical infrastructure and for funding to be able to deliver on this is really critical. We've already heard a little bit about what we call health in all policies. We need to address air pollution to, again, prevent people from needing care, and that reduces the strain in our hospital settings and primary care settings. And of course, there are other issues articulated in the National Health and Climate Strategy, which is, of course, about the resources we use. And we hear from nurses and have for many years about the use of plastics, the scourge of plastics in our healthcare settings. These are things we need to address. We need resourcing, not only just in government, but in and throughout our alliance, so that we can resource support and train workforce and support workforce directly. Thank you. Next slide. And so this is around peer-to-peer training. This is around resourcing that significantly assists the nursing and midwifery workforce and our broader healthcare workforce to be able to respond to the challenges, to be able to lead. And this is a picture of leaders from across Australia, including our 2 sustainable healthcare leaders, both still working on the floor 1 or 2 days a week. They see the challenges on the floor, and they're sharing those with colleagues nationally. But most of these people only work 2 days, 1 day a week in these really critical roles. We need to resource people and infrastructure, but also the translation of research so that we can get better policy outcomes. Thank you so much.
Thank you, Michelle, for sharing the importance of having a funded strategy, and also acknowledging that much of this strategy in the National Climate Risk Assessment was built, and the report was built on some of the expert research that has come from some of our speakers today. And so much of the work that we have today and that we benefit from today is from that research. I'd now love to introduce Assistant Secretary of the ACTU, Liam O'Brien, to speak about fossil fuel subsidies. Before joining the ACTU, Liam was a Victorian Assistant Secretary and National Vice President of the Australian Workers' Union. Welcome, Liam.
Thanks, Caitlin. I'm hoping you can see my slides. Tell me if you can't see anything yet. Hoping that's working there.
Yes, all working.
Yeah, great. Excellent. Well, thank you to you. Thank you to Annie, and thanks to the mighty ANMF for the opportunity for joining you on what is a really important public health event. As you said, I'm Liam O'Brien. I'm an Assistant Secretary at the ACTU, and I'm going to talk to you about the need to reform our tax system to end the subsidies that shift billions of taxpayer dollars into the hands of big foreign gas exporters and multinational mining companies. I do want to start by acknowledging country and join you. I'm here on the lands of the Wurundjeri people, the Kulin Nation, and I pay my respects to elders past and present. And so let's start with the facts. And it is an open secret that as we speak, Australians are getting completely ripped off. Every year as taxpayers, we fork over almost $15 billion in subsidies to giant coal and gas companies, some of the wealthiest corporations on the planet. And that's about $550 every year from every single person in the country. How does this happen? Well, it starts with 2 giant subsidies that have been in place for decades. And the first of those is called the Petroleum Resource Rent Tax, or the PRRT for short. And the PRRT is meant to be the main vehicle by which Australian taxes the gas drilled in our lands and our waters and is exported overseas by private companies. That gas belongs to us, the Australian people. And the private corporations are making an absolute killing, drilling it up and shipping it overseas. It's damaging our climate, but most importantly also it's damaging local jobs and driving up our own gas prices here as well. Because of that, you might assume that the Australian people would be getting a fair cut of the giant profits that are made using our sovereign resources. After all, other countries have struck pretty fair deals with these industries. If we look at it, Norway taxes its petroleum exports at 56%, and that's on top of its corporate tax rate. They've used that revenue to amass the largest sovereign wealth fund in the world, a gargantuan $1.8 trillion pot. For reference, that is more than the current annual GDP of Australia, and that underwrites social services, healthcare, renewable energy, and education across the country. Qatar, a completely different political and economic system, but another one of our top 3 gas exporting countries. It taxes its gas exports at 46% on top of its corporate tax rate. In 2022-23, Qatar exported $83 billion worth of gas, collected $38 billion in export royalties. But concerningly, in that same year, Australia exported $86 billion worth of gas, so a bit more, and collected a pathetic $1.9 billion from the PRRT. Why is this happening? Well, because the PRRT is an instrument that has been shaped by the gas industry for the gas industry. It's a perfect example of corporate capture, a powerful vested interest quietly shaping our public policy to undermine not only the public interest and pad their own profits, but do huge damage to our climate and our planet. In fact, this tax is so riddled with loopholes and deliberate complexities that a full 2/3 of the gas projects that should be eligible for paying it have never paid a cent in the whole time the PRRT has been in operation. In fact, for every $100 of gas we export, the Australian people get less than 43 cents in return. That's 43 cents, not dollars. It is almost, well, it is an insult. You know, if we think about it, you know, we are absolutely being scammed. The second subsidy I want to talk to you about is the fuel tax credit scheme. This scheme gives a tax credit to large users of diesel fuel based on the amount they use. And the biggest beneficiaries of these are by far big mining companies, whether it be iron ore or coal. And they use a ton of diesel in their mining operations. And the fuel tax credit scheme is the biggest federal budget item you've never even heard of. Between 2007 and 2030, the scheme is expected to have cost the Australian public a staggering $184 billion. That's billions every year that we're just giving away to giant mining companies. Why? Well, because they've lobbied for it and they've threatened any politician who would question it. Even the centrist think tank, the Grattan Institute, it concluded lightly that the fuel tax credit scheme just has absolutely no rationale. The former Liberal Treasurer, Matt Keane, and the current chair of the Independent Climate Change Authority has called the scheme, quote, insane. And yet we're living with it right now, with billions of our tax dollars padding the profits of already super profitable mining companies. So why does this matter? Why does this matter for health workers? Well, there's 2 reasons. First, because these subsidies are actively incentivizing more climate pollution. They incentivize more climate pollution because they make the activities of extracting and exporting fossil fuels artificially profitable. Because the PRRT is so weak, gas companies are incentivized to continue expanding their operations and to ship much of their gas as possible overseas, despite the fact that Australian domestic householders and industry often facing gas shortages. A huge irony for a country that is literally awash in gas. The gas industry is a huge emitter of methane, a greenhouse gas 80 times more potent than carbon dioxide. And when that gas gets shipped overseas and birthed, it drives the Earth's thermometer a notch higher every year. In fact, climate pollution from Australia's fossil fuel exports is about 3 times greater than all the climate pollution produced by our domestic economy. And the fuel tax credit scheme, well, it incentivises the mining industry to keep using diesel and not to electrify any of its operations. Diesel is a highly polluting fuel that emits lots of carbon dioxide when burnt. It's hazardous to human health, including to the workers that are around there. And so we're essentially paying coal mining companies and the industry to continue to use as much of it as possible. This is completely bonkers. It's backwards. We need to be incentivising these companies to decarbonise as quickly as possible, not driving them towards an even more climate pollution. And make no mistake, every time these companies emit another tonne of carbon or methane into the atmosphere, it triggers more warning, which triggers another increase in the frequency and intensity of heat waves, bushfires, floods and storms, many of the things other guests have spoken about. This is a public health crisis and it is growing, and health workers are often on the front lines of that crisis, treating paediatric asthma from bushfire smoke, or conducting triage in flooding communities, or tending to children or the elderly who succumb to heat. The causal chain is long, but it is clear. The pollution released by these companies, which are currently subsidised, putting health workers at risk. The more they are encouraged to pollute, the greater the risk becomes. The second reason is simple. That money is yours. Those resources belong to us, the Australian public, and they're not renewable. Once these companies use them, they're gone forever. These companies should be paying Australians fairly for the use of our resources. Instead, we've wound up on the hook for billions of dollars in subsidies to keep their profit margins artificially high. So what can we do about it? Well, the ANMF has laid out in its Lancet Countdown. We can replace the PRRT with a simple 25% export levy on all exported gas, and we can cap the fuel tax credit scheme so the giant iron ore and coal miners no longer receive subsidies. If we did both of those things, we would raise between $10 and $20 billion in revenue every year. What we could do with a cool $20 billion? Well, first we could fund the long unfunded National Climate and Health Strategy, which you just heard about. In fact, you could probably fund it a dozen times over. You could fund local government associations to retrofit roads, bridges, storm drains, fire barriers, whatever is needed to keep their communities safe from the worsening climate impacts. The ASU, the Australian Services Union, has called for $400 million per year over 5 years just to do this. You could fund a National Emergency Response Brigade, deploying full-time, well-paid fire and emergency rescue personnel and health workforce and support staff to enhance the national response to climate-related emergencies. The United Firefighters Union of Australia has asked for $600 million just to do that. You could do all of that, or you could fully fund an average-sized 7-kilowatt solar system for 2.5 million additional homes, saving them each thousands of dollars every year on energy bills. Australia only has about 10 million households and 4 million of them already have rooftop solar. So this would put a massive dent in that task. And so you might have heard Australia has a bid to host COP31 next year in Adelaide. This big annual United Nations climate negotiations, which almost every year in the country, every country every year attends. If we're successful in our bid, then the eyes of the world will be on Australia and our climate record. Back at COP28, which happened in Dubai, all countries in the world signed onto a document agreeing to phase out inefficient fossil fuel subsidies. But so far, we've seen very little in the way of implementation. Now is the time for Australia to lead the way by example and phase out 2 of our most egregious fuel subsidies. But it won't happen without a push, and nurses and midwives can lead the way. The ANMF, as Annie said, is the largest union in Australia. When you flex your muscle, decision makers listen. But equally important, nurses and midwives are deeply trusted and respected by the public. Your jobs are grounded in altruism and solidarity, in looking out for people and keeping people safe and healthy. When nurses and midwives raise their voices to talk about climate change and the public health crisis and to demand change, people trust that and people listen. The Lancet Countdown is going to be the beginning of something really powerful. And I can't wait to tell the story that once we've won, about how nurses and midwives rose up to claw back billions of dollars in funding climate pollution and to redirect it all into a healthier, more resilient Australia for decades to come. Thank you.
Thank you, Liam. You've somehow managed to make tax reform really interesting and lively, which is no easy feat. So very, very grateful for your presentation. We now have the opportunity to ask the experts in this call some questions. And so I'll get Ivan, Liam and Michelle to pop your cameras on, and Paul also, if you're happy to take questions, so that we have, that's if Paul's still with us, we can ask questions. And I remind those that are in the, that are attending the webinar that you can pose your questions in the Q&A function that's at that should be at the top of your screen. So I might throw our first question that we have today over to you, Ivan, which is, does a nurse or midwife need to be thinking about global greenhouse gas pollution every hour of every day? And I suppose this also appeals to, health workers, whether you're a nurse, midwife or doctor or allied health professional. Is it something that we need to be thinking about every hour of every shift, or every time we dispose of something like a PPE item? Over to you, Ivan.
Well, hey, Caitlin, yeah, I think that picture that I showed that the WHO has published with health facilities and clinical settings with a chimney may have prompted you to focus on that. That is a pollution emission source. And health professionals, as Liam eloquently said, are leaders and lead by example. And I think there's two kind of perspectives. Everyone should always be trying their best. It is a time to pull together as an entire global community. But health professionals and medical professionals have always kind of had that role in society to model and to promote health behaviours. And this is no different. So I think it's a huge burden, but it kind of is something that we sign up to as health sector professionals to lead the way and to take that on board, because we are also saying that everyone else in society needs to do this, but it's important to clean up your own backyard first.
Yes, well said. And agreed. I think when I started to learn about idling off around, daycare centres and schools, it was something that I really reflected on my own contribution to air pollution. So, yeah, very well answered. Michelle and perhaps Liam, I think you could both speak to this, but we might go to Michelle first. We have a question in the Q&A about how we advocate for funding and having a dedicated budget for the strategy. Michelle, we might hear from you first, and then Liam, you might have some comments, because you talked a little bit about what it might mean to have tax reform and how that might release savings or funding that we could put into the National Health and Climate Strategy. Michelle?
Thanks, Caitlin. Well, this is a great start. The ANMF partnering with the Lancet Countdown and having this really practical policy platform and really getting involved and being able to talk through your networks and spheres of influence about these platforms is critical. Obviously, the ANMF is part of the Climate and Health Alliance, and we regularly, even though there hasn't been governance in place around the National Health and Climate Strategy, I would say, for the last 10 months, it's been a bit slow to, the elected members have been a bit slow to re-establish that post the election, and we really need this governance in place. But, the health budget is $270.5 billion in Australia, and some of the things that are articulated in the strategy, there's co-benefits and there's win-wins, with the saving of resources alongside value of care. So we don't want to compromise care here. There are huge savings to be made. There's a lot of inefficiencies in the way that we do things, the materials that we use, including plastics, which are right in front of us on the floor, that we don't want to use, that can actually really save money. And so what we're trying to do is look at that leadership across the country, draw that together and advocate for resourcing, dedicated staff and dedicated solutions to remove those impacts. But of course, there are other funding sources, and this is what Liam's just enlightened us with, with this, really shocking facts around where we invest our money and the missed opportunities to shift funding away from things that harm our health and then are exacerbated by climate change impacts, causing climate change, exacerbating climate impacts, which ultimately we see in hospitals and healthcare settings. So tuning into these three policy platforms is going to be really critical, and the National Health and Climate Strategy resourcing the effort to ensure that actions happened and our voices are heard are going to be really critical to shift other policies and other drivers.
Thank you, Michelle. Yes, so well said. I think we can all really relate to what it means to have inefficiencies that need reforming, and to see those inefficiencies and see better ways of doing things is something I think we can all relate to, irrespective of whether we're academics, researchers, on the floor, in policy. Liam, did you have anything that you wanted to add?
Well, I agree with what Michelle said. I think events like these are a great way to start to turn the tables a little bit. I want to talk a little bit about politics, though, because this is fundamentally a political question, and politics is one of the greatest participation sports we've got in this country. And I suppose one of the crazy things about this situation when we talk about tax reform is it really is a win-win. It's a win for taxpayers. In other words, you and me and every one of the millions of Australians that pay income tax every year that are literally shifting their taxpayer dollars into the pockets of foreign-owned gas and mining companies. And not only is it a win for us in terms of our tax revenue, but it's also a win for the climate. And so what's crazy about this from a political point of view is I want to let everyone in on a bit of a secret. The foreign gas companies don't get to vote. we have a huge amount of power and influence in this game. And the fact that we just need to mobilise like every other trade unionist gets is a really key part of how we advocate for a better deal for Australian taxpayers, but arguably measures that are going to help save the planet. So I think this is one of those rare opportunities when it comes to tax reform where we can genuinely present a win-win. We're saving the climate. We're creating better intergenerational equity by taking some of that money out of the pockets of very, very wealthy corporations who do not even pay corporate tax here, back into the hands of working people. But importantly, starting to redirect some of that much needed gas back into our domestic market, but slow the rate of international exports, which we know are causing huge damage to our climate.
Thanks, Liam. So well said. And yeah, I can really see the vision of having something like the National Health and Climate Strategy funded, seeing roles emerge in climate that are supported for healthcare workers to be able to do the job that they do. We know that healthcare workers are incredibly resilient, but we need a system that is also matching that resilience. And that comes through, funding something like the National Health and Climate Strategy, where we can see jobs, we could see protected time for healthcare professionals to advocate for climate change. I had one last question for you, Professor Paul, just in relation to the global indicators. I know that many research teams will be setting their agendas and looking to progress research on climate and health in the coming months and years. And I wondered if you had any advice based on you have such a global overview of what the indicators are saying and where we need further research. What would be your advice for researchers that are looking to shape the climate and health research agendas?
Thanks, Caitlin. That's a great question. I think Australia is well served by many people with expertise in health and climate change. We have the HEAL network, which brings together hundreds of researchers in this area. I think one of the areas that is really taking off at the moment that is really important is climate change and mental health. We've seen with the huge disasters in Australia, the bushfires, the floods and so on, that it's not only the physical health that has an impact, it's also mental health that is hugely impacted. So I think we've got great expertise in that area, as I said, and I think we need to really open up that area. So that's an area that we're hoping to bring in a new indicator into our report. We've explored that area to some extent in the past, but hopefully our report next year will have a climate change and mental health indicator so that we can try and quantify it and track it and make sure that we're moving in the right direction. Indigenous health is also extremely important, as we've heard others talk about. So I think, again, we're working with Indigenous researchers at the moment to try and expand that area of research, but also to be able to bring it in as an indicator to be able to track and make sure that our First Nations people, not only here in Australia, but in other countries around the world, are not being unfairly impacted by climate change and can be protected as they should be. So I think mental health, Indigenous health are really two key areas at the moment.
Thank you. Such great advice. So I'll be jotting that down, and also I'm sure that many were also taking notes on that too. Well, that brings our panel questions to a close. So panelists, you are welcome to turn your camera off. But I do have the delight now to formally get to the exciting part of the webinar. If it couldn't get more exciting than already what we've covered today, where we officially launched the ANMF Lancet Countdown 2025 Climate and Health Policy Priorities for Australia. This report was jointly prepared by myself, my co-authors, Associate Professor Micah Peters, Rosalind Morgan, Registered Nurse, Melanie Eslick, Registered Nurse, and Lauren Woodsmith, Registered Nurse, and editors Annie Butler, as well as Manua Saeed and Elise Digger from the Lancet Countdown, all of whom I wish to formally recognise and acknowledge for their contributions and hard work on bringing this together. You can access the policy report in its full entirety via the QR link provided and in the country resources section of the Lancet Countdown site, which is also where you can find access to the Global Indicators report and an amazing fact sheet on the Australian specific indicators. Today we have had the privilege of hearing from Associate Professor Ivan Hannigan on air pollution and different sources of air pollution, which is why we call on the Australian government to introduce a national clean air framework for health. We heard from Michelle Isles about the importance of funding the National Health and Climate Strategy, this amazing strategy that we have that will see progress on climate and health be reached once we have funding. And also from Liam O'Brien, which is on fossil fuels and the impact that that has on climate change and how our subsidisation of these industries is perpetuating the issue and our reliance on fossil fuels, which is why we are also calling to redirect fossil fuel subsidies towards health and climate resilience. I want to really thank our expert speakers once again today for contributing to this webinar. Over the next few weeks, the Australian Nursing and Midwifery Federation have partnered with Renew Australia for All to campaign on the importance of placing health at the centre of Australia's climate policy. So please do stay tuned for next steps in this and more details on this particular campaign. Now, lastly, I'd like to thank all of you for joining us today as we discussed the evidence, we covered the opportunities, and we looked at the solutions once we'd heard from our incredible speakers. This is now reaching the end of our webinar. Please note that as we have recorded it, we will be circulating the link to the recordings at the closure. Thank you once again, and I wish you well.